It's a scary thing, and a lot of times your provider will want to do ultrasounds to kind of follow along with how big it looks inside. But the thing I want you to pay attention to is if you are bleeding during pregnancy, is it painful? And that is because we don't want you dilating. We don't want that cervix opening up and letting those blood vessels be exposed so that you bleed too much. I do realize this video got progressively scarier the further along it went. And the good news is most of the reasons for vaginal bleeding during pregnancy are not scary. Any vaginal bleeding during pregnancy is scary, no matter what way you spin it. And most women who experience vaginal bleeding automatically fear the worst: miscarriage. But while miscarriage is one of the reasons for vaginal bleeding during pregnancy, there are actually a ton of very normal reasons for vaginal bleeding, and we're going to talk about those today. And the good news is, most of the reasons for vaginal bleeding during pregnancy are not scary. My name is Galloway, and I'm a certified nurse midwife. I've been doing this since 2012, and let me tell you, I have walked through many pregnancies with women who experience bleeding, and their bleeding is actually very explainable. So if you're enjoying this content, make sure to like and subscribe. One of the first things that I ask women when they tell me they're having some vaginal bleeding is, did you have sex? Especially in the last 48 hours. Now, sex for most pregnancies is not a contraindication during pregnancy. You can have sex during your pregnancy. You can have it during your first trimester, second trimester, and third trimester, unless your provider tells you not to. So why does sex cause bleeding? Well, let me clarify. When I say sex, I mean vaginal sex, because anything going inside the vagina can disrupt the vaginal wall or can disrupt the cervix. Now, the cervix during pregnancy especially has tons of little capillaries, and if you touch them, sometimes they bleed, especially if you have a vaginal infection, which is the next reason that a lot of women experience bleeding during pregnancy. So vaginal infections come in lots of shapes and sizes. They are much more common during pregnancy. There's one called bacterial vaginosis, which is the probably number one culprit for vaginal bleeding. You also have yeast infections, and then you have those pesky sexually transmitted infections, so you want to make sure you don't have one of those because those can cause bleeding. And then sometimes you might not be sure where the bleeding is coming from, so you think you're having vaginal bleeding, but you actually have a urinary tract infection and you're having bleeding from your urethra. And then as a bonus, and this has nothing to do with infection, but it's all in that area, you could also be having rectal bleeding. Constipation, hemorrhoids, all those are very common in pregnancy, and they can cause bleeding. So if you're having vaginal bleeding or what you think is vaginal bleeding, make sure to A, check out the source. Is it really coming from your vagina? And B, get it checked out, because most of these things are easy fixes. Something most of you probably have not heard of are subchorionic hemorrhages or subchorionic hematomas. They are both words in the medical field. You can use them interchangeably. And subchorionic hemorrhages are bleeding that occurs especially in early pregnancy when a little bit of the bag of water detaches from the wall of the uterus and causes bleeding. And sometimes that bleeding can be significant, so much so that you are sure you're having a miscarriage. But the thing I want you to pay attention to is if you are bleeding during pregnancy, is it painful? Because if it's not painful, it's unlikely to be a miscarriage, especially if you're having heavy bleeding. If you're having heavy bleeding but no pain, I wouldn't be surprised if you go in and get checked out and they find a very healthy baby in there, but a subchorionic hemorrhage. Now, if a subchorionic hemorrhage is big enough, it does increase your risk of miscarriage, but it certainly does not cause miscarriage in most pregnancy. It's a scary thing, and a lot of times your provider will want to do ultrasounds to kind of follow along with how big it looks inside. But for the most part, what happens is by a certain point in pregnancy, your body just reabsorbs that blood and the subchorionic hemorrhage is magically gone. So while it's scary, it's usually not something we worry about all that much as it pertains to miscarriage. Lastly, how many of you have heard of placenta previa? Well, if you haven't heard of it, what it is when the placenta implants low inside your uterus. So you've got a uterus, which is like a balloon, and the neck of that balloon is your cervix. So your cervix is this hole, right? And most of the time it's closed. There's not an opening until labor happens. And so when that placenta attaches on top of that cervix, then what happens when that cervix starts to dilate is that those blood vessels where the placenta attaches can break open and you can have bleeding. So that's one of the causes of vaginal bleeding during pregnancy. Now, we typically don't diagnose placenta previa until after the 12-week mark because that's usually when the placenta is fully developed and we can actually see something like that. And there are different definitions of previa. So complete previa is when the whole thing is over the cervix. And then there's partial, where part of the placenta is covering the cervix. And then there's something called a low-lying placenta, which is not a previa, but it's close to being a previa. So the placenta is low in the uterus, it's very close to the cervix, and if that cervix were to dilate, then you could still have bleeding from that. Now, if you have a placenta previa, most of the time, your provider is going to put you on something called pelvic rest, and that's where they don't want anything inside your vagina. They're often going to give you some activity restrictions, and that's all to keep you from having bleeding with it. So even if the cervix isn't dilating, theoretically, if we disrupt that lower part of the cervix and bump into that previa enough, into that placenta enough, it could start to bleed. And the risk of previa is that you bleed so much that it can be life-threatening to you and your baby. So you want to avoid doing anything that could disrupt that placenta. Now, the good news about placenta previa is that most of the time they resolve on their own. And they're scary when they happen for most women because you're told you can't have sex and do all these things because you might bleed too much. But the uterus starts out the size of your fist and then ends up very big, right? And so when the placenta starts off down here, as that uterus grows, the placenta goes with it. And then it gets out of the way. But what happens if the placenta doesn't get out of the way? If it doesn't get out of the way, then you're going to be recommended a C-section. And that's for a complete previa, a partial previa, and a low-lying placenta that is too close to the cervix. And that is because we don't want you dilating. We don't want that cervix opening up and letting those blood vessels be exposed so that you bleed too much. So usually if you have a previa, you're actually going to be recommended C-section around 37 weeks because we don't want any chance of you laboring. Of course, it can happen, but we're trying to avoid it the best we can. I do realize this video got progressively scarier the further along it went. But my ultimate goal was not to scare you. My ultimate goal was to tell you that if you have vaginal bleeding during your pregnancy, try not to freak out because a lot of times it does not mean miscarriage. And a lot of times it doesn't mean anything scary. In fact, the most common cause of vaginal bleeding I find during pregnancy is bacterial vaginosis, a common vaginal infection. But if you're having bleeding, I encourage you to go ahead and get it checked out because you never know what might be going on. And even if you do have a vaginal infection, you kind of want to get that taken care of, right? Now, if you'd like to learn a little bit more about STIs that could cause vaginal bleeding during pregnancy, I encourage you to check out this video about some of the most common STIs. And if you have questions or comments or stories about your pregnancy, I'd love to hear about them. Make sure to put them in the comment section. And thanks for listening, everybody. Stay healthy out there.